everyone, this is Dr. Atse and I want to welcome you back to The Voice of a Doctor. If you're joining us for the first time, don't forget to go through the channel trailer to see what this channel is all about. Today I'll be talking about the vitamin B12 deficiency. It's a very important one, an essential vitamin in the body. I'd like you to listen, and please don't forget to like, subscribe and share with loved ones, friends or family members who you think might be going through one or two of these symptoms that you think they might benefit from it. Once again, share your comments. They do mean a lot to me. So vitamin B12 is one of the essential vitamins in the body. Really what it does, it's involved in the making of red cells, nerves and DNA. So these three things are very important. We need our red cells to transport things like oxygen across from every organ, from muscles to bones to brain, etc. We need our nerves, which helps for everything that we do, to speak, to see, to smell, to feel. That's all the making of a healthy nerve. Also for the DNA, you all know what DNA is, from the making from conception up to now. We need our DNA. Okay, so really understanding that the B vitamin is involved in these intricacies of our lives, it would help us appreciate those things that would happen if we lack it. There are a few reasons why one could lack vitamin B12. This could range from having a poor diet to having a diet that completely lacks vitamin B12. For example, a vegan diet is one that completely lacks vitamin B12. Another reason is if we have had a previous bowel surgery, like a gastric bypass surgery, or someone who have had to have surgery as a result of other health conditions, for example, an inflammatory bowel disease. So basically, the vitamin B12 cannot be made in our body. Rather, it's something that we've got to take in from, our diets. So the symptoms of B12 deficiency, it's quite a list. I'm just going to start with the most common ones. Most commonly, people present with feeling tired all the time. They feel really tired and exhausted with any little thing they do. Also, they could present with psychological problems such as a low mood or depression, a feeling of confusion, right, and poor memory. Don't forget I said that the B12 is involved with the making of red cells, and so red cells are involved in carrying things like oxygen around the body, and therefore if oxygen is not adequately carried around, the body can easily be fatigued and exhausted. So this is where it's coming from. Likewise, there are things like some neurotransmitters, things like serotonin or dopamine, that helps, those excitatory things that helps in the brain to stimulate and keep our mood where we should function adequately. Now, if these things are low, then one presents with low mood, memory, impairment, confusion. Okay. Also with the with B12 deficiency, you get presentations such as feeling shortness of breath, feeling dizzy. Amongst the elderly, you commonly see them presenting with a bit of clumsiness, and so they are prone to falls. Also confusion, mobility is one of the big problems. So B12 deficiency can also be associated with poor vision. So some people will present with blurry vision, and again, this is coming from when the nerve innervating the eye is being affected, the optic nerve. So we have blurry vision or poor vision. We also could present with a feeling of pins and needles and numbness, right? It could be anywhere, from our feet to our skin to, just anywhere. One could also present with things like a swollen or beefy red tongue. B12 has also been associated with symptoms of skin dermatitis, poor nail growth or easily broken nails, as well as having poor hair growth. Also on the hair, some people could present with premature gray hair formation. This also has been associated with vitamin B12 deficiency. Now, in the area of our GI tract, B12 deficiency has been associated with symptoms of diarrhea and also poor absorption of the food that we eat. So people present with bloating, diarrhea, just uncertainty in keeping with an irritable bowel state. So these are the those symptoms all around that one could present with when it comes to vitamin B12 deficiency. So definitely you would agree with me that this is quite a small but mighty essential need that we all need in our body to function, and that is this essential vitamin called the vitamin B12. I'm going to talk quickly about the treatment, as well as how we can the diets that we can get vitamin B12 from. Please don't go away. So before we look into the treatment of vitamin B12, I'll quickly say here that the diagnosis is straightforward. First thing is, if one is having any of these symptoms, we encourage you to see your doctor. First thing is to run a simple blood test, and if it confirms that the vitamin B12 is low, the other thing is to discover, to find out where it's coming from. Now, if one is having B12 as a result of poor diet, then it can easily be corrected with tablets, B12 tablets. However, if it's a problem that is coming from our guts, maybe there's been an operation or a bowel surgery, or one has something like an inflammatory bowel disease, then even if you take it, you cannot absorb it, and so the treatment is best given by injections. And the B12 treatment oftentimes is a lifelong kind of treatment, because you need these things to function lifelong. So the treatment is replacing by vitamin B12, either tablets or by injections, and it is the prognosis, if corrected and if it's maintained, then it's good, and one could carry on with a normal lifestyle. Okay, now the vitamin B12 can be gotten from diets that's such as meat, fish, eggs, dairy products, yeast extracts like from things like marmite, that is known to be very rich in vitamin B12. So these are everyday diets that we see. Okay, so it's something that can easily be corrected and avoided if we are well informed. So I hope that I've been able to share light on this very important topic, and I'd like you to share your views, share your opinion, and if you know anyone who's going through this, by all means talk to them, let them see their doctor and run this quick test to see if it's something that can easily be corrected. Thank you so much.